Hey everyone, here Dr. James Fedich, Clinic Director at Village Family Clinic in Hackettstown, New Jersey. Get a lot of questions about knee pain, so I want to just discuss one of the most common symptoms and causes of knee pain that we see here in the clinic. So with me here is our friendly friend Steve the Skeleton here. I just want to show you what a knee joint looks like in a video here. So we got this top bone here called the femur, and the shin bone that you have that you feel coming out here called the tibia, and a little side bone here called the fibula, which isn't affected too much. But the knee's a joint just like any other, two bones meeting together. We got the inside and outside part of the knee. The unique thing with the knee, the way we walk all the time, is that it puts a lot of pressure on the inside of the knee. So when the knee wears out, there's a lot of different things that can happen to knee, ACL tears, meniscus tears, a lot of different conditions. But one of the most common things we get asked about is degeneration or arthritis in the knee. One of the reasons why the knee is so unique, the way we walk puts very uneven pressure on the knee. So arthritis is very simple. Anywhere in the body, two joints should have a nice spacer. As we get older or trauma accidents happen, they start getting a little bit too close together and they start rubbing, and that's when people have pain. And the point from here to here can often be a long time where it starts rubbing. The unique part about the knee is that the knee doesn't wear evenly. The inside starts rubbing and the outside will not rub. It's actually pretty uncommon to see it's totally flat on both sides. It's just the way we walk and the way our hips, our anatomy is, that the inside will rub or bone on bone. So any arthritic knee pain patient's going to always have pain on the inside of the knee first. And what that looks like in a little more zoomed up model here, again, we have the two sides of the knee. This is the outside, the inside. This just shows how the inside of the knee will start rubbing like this before the outside will. So there's a lot of options for this. You know, if the knee gets severely worn out, we just talk about sending to an orthopedic surgeon and getting knee replacements. But before we get that aggressive, there's a lot of treatments you can do, try to help before. The least invasive that we try to help, physical therapy can be very helpful. But one of the best things is these specialized knee braces that we do, these decompression knee braces. And what these braces are specially designed just for arthritic knees. It's one in the package, so we can use it, but it looks a little more daunting than it is. It's just a nice metal brace. It's got two sides, but what will happen, we'll actually take it out. It's hard to appreciate, but the two sides are uneven, so there's one for the right or left. So in addition to giving you some support and structure, what it'll actually do as the inside of that knee is wearing out, the knee will kind of look like this, where the outside's got the gap and the inside's worn out. The brace actually gently pushes or puts that knee back in position so that it can move slowly and speedily both ways without causing some pain. Whereas now it's doing this, and every time we move it rubs. But if that knee brace can just gap that a little bit, we're able to move freely without it rubbing. So really one of the first, when we're starting to feel that arthritic knee pain, people think they got to go right for surgery. That's kind of last resort. Try something like this. These knee braces, we do them here. They're covered by Medicare and most major insurances. Take the pressure off there. Sometimes that can give you relief for years. And we talk about next cortisone injections, and now there's some new injections, Supar, Synvis, those kind of things, which are synthetic lubricants that we can do for knee pain. But the first line of defense is some physical therapy, a good knee brace to take some pressure off the knee, and hopefully avoid surgery for you in the future. So thanks for asking about knee pain.